had a question. Can you give us like a overview of your platform and how it's integrated into someone's practice?
Yes, so WoundZoom is an integrated digital management solution that really brings advanced digital technology into wound care. It's designed to improve provider performance and patient outcomes, and we're really focused on four key pillars: patient assessment excellence, practice efficiency, insightful analytics, and patient safety.
Largely in the United States, we're still using a metric ruler and taking a picture from a camera or a phone. So our accuracy and reliability of wound measurements is just simply not there. If somebody perhaps is novice to this area of considering purchasing a software like yours, talk me through, a patient walks into a room, what's the next step and how is your program integrated and how is it utilized during that time of the visit?
WoundZoom is broken out into two key components. The first component is a mobile application used on smart devices, and they'd use that at the point of care. So when they walk into a patient room, they'd open up their smartphone or smart device, and they would open up the application and then go on that patient, pull up the patient records, and then manage the whole visit via their smartphone. So what does that entail? It really entails their ability to go in and pull up the wound information and demographics for that patient and modify that, or if they're doing a follow-up visit for the encounter, they can just click on follow-up, do all the advanced imaging for that, the assessment, and then that syncs back up to WoundZoom Connect, which is really the brains of the system, which is a wound-centric portal, which enables the clinician to have insight into the encounter from a patient encounter standpoint, so they can drill into the healing charts, the trends, individual patient-specific reports to see if the wound is, healing or stalled, or other treatment plans they may want to do to that. And then more importantly, for larger facilities and practices, they have ability to see the whole wound census through our intelligent wound-centric dashboard. So it gives them kind of a cockpit view to be able to go in and drill in and manage their whole practice.
Do you think CMS will say you must have a digitized picture measured by a device rather than using a metric ruler? Do you think that's the direction they want to go?
I think if you look at the recent LCD changes in there, correct measurements was mentioned roughly 21 times. So we know the variability with manual measurements right now and how critical it is to make sure that you have consistency with your measurements.
I think it's going to be a more regulatory piece that we all have to abide by.
Yeah.
Just like EMR, that was
exactly.
It's just natural evolution.